In 2013, employers paid 32% more for employee health plans than they paid 5 years ago, and the upward trend isn't changing direction anytime soon. If you're watching this, you're probably thinking, tell me something I don't know. How about this? 13 cents of every premium dollar you spend goes toward insurance and administrative costs. That's the base, the number most employers and brokers focus on when they're shopping for a plan or looking to renew. The rest, 87 cents of every premium dollar, is paid out in claims. Physician costs, prescriptions, hospitalizations, and other medical service. These are the real drivers of your healthcare costs. So, if you're looking to cut your healthcare costs by, say, 10%, where would you rather focus? On saving 10% of 13 cents or 10% of 87? Now let's put that number in real terms. Where are the costs coming from? Well, just look around you. Of any 10 employees in the average workforce, 1 is diabetic, either diagnosed or undiagnosed. 2 smoke. At least 2 have high cholesterol. 3 have high blood pressure. 3 are pre-diabetic, meaning their blood sugar levels are high enough to develop full-blown diabetes down the road. 3 have metabolic syndrome. More than 6 are overweight, and half of those are obese. That's where your risk is. That's where your greatest costs originate. And that's where you can reap the greatest savings. To attack healthcare costs where they start takes a 3-pronged approach. 1. Identify your at-risk employees. 2. Transform that risk with a targeted plan of action. 3. Hold employees accountable. This is the basis for our risk management approach, which can reduce your claims costs by 11.5%. In real numbers, that means if your group of 100 average workers incur an average of $11,000 a year in healthcare costs for a total cost of $1,100,000, you could avoid $126,025 in claims annually. Oh, let's not forget about that 13 cents. If you decide to simply continue focusing on that portion of healthcare dollars, any achieved reductions are likely to be offset by cuts in Medicare reimbursement written into the Affordable Care Act. Why? Historically, when Medicare rates decrease, the private payer, that's you, the employer, are charged more for providers to make up the difference. So if you really want to control your healthcare costs, where would you rather focus? On the 13 cents or the 87 cents? The obvious answer is 87 cents, and the obvious question is, how far are you willing to go?